Hello, welcome to my innovation project using the Epocrates App to prevent medication errors. My name is Chinwe, and I'm going to be talking on my signature assignment, and these are the problem areas that I'm going to look at. Also, I'm going to describe the problem. Medication errors have been has undesirable consequences. It increases the length of time in the hospital, increases disability, and it causes increase in pay for patients. Also causes potential harm. Children are affected mostly because you can tell that because of their vulnerability. In this case, in 1995, 12 occurred, and among them 10 were fatal. And also medication error occurrences, deciding which medication to give, which medication prescription errors, dispensing the formula, monitoring therapy, administrating and taking the medication. And we want to look at the types. Prescription error type were caused by 21%. 22% were caused by medication delivery error. 33% were caused by administration error. And we'll look at psychological problem that it has, is the knowledge, the delivery, the medication. These are the things that, also looking at the problem, going background of the problem. It's medication errors are classified as one of the, errors in general medicine, and among them 44 to 98,000 were caused due to medical errors, and 77,000 of them occurred due to medication errors, and it resulted in 6.1 to 6.5 billion dollars spent by the American government. It also increases every year. Hospitals have increased patient turnover, new drugs are emerging, so it's difficult to safely manage them and effectively. Also, Medicare is becoming more complex, more aged population factors that this also risks the medication errors. Also, the medication errors may not be known. The problem, because they are underrated, they're underreported. Medication errors can go unrevealed because the process leads to harm, and people are afraid to report it, so they are underreported. Some of them, evidence has shown that it goes and increasing all the time. Also, nurses and nursing students are the most targeted that make this medication errors. And some of them that were interviewed, 40% of the nurses said they have made errors in their lifetime. And a lot of them said that all the errors that we see that are, that are rising comes from the nurses and the nursing students, because some of them don't even report it anyway. So if they are reported, you can tell the prices will go, the rates will go up. And among the survey that was done by McCarthy, 48.5% said most common type of problem were forgetting drug prescription. In a study as well that was done by Balance and Company, it said 30% of the nurses interviews surveys said at least they reported one error. Some of the things that were lacking were pharmacological for information, wrong medication calculation regarding protocol, similarity in shapes, similarity in drug names, physicians and providers, bad handwriting. In UK, prescription error caused 1.5 were caused by 1.5%. Choice of drugs errors 54%. Potential error 0.4. And also, among the 40,000 medication errors in 173 hospitals in Wales conducted in a 6-month survey, 15% caused slight harm and 5% caused moderate and severe harm. Also, look at the process goes on and on. 1.57 prescription dispensed in the US. Among it, 3 billion actually prescriptions were dispensed and in America each year. And among that 3 billion, 50 will contain errors, and 0.1 were thought to be clinically important. And among them, given an annual incidence of errors about 50%, wrong labeling information and instruction were the most types of errors. From 1983 to 1993, there were more errors. It kept going up. From 2,876 to 7,391. This is from 1990 to 2000 alone in UK. Another study by Hughes and Orris shows that 30% of patients were affected by medication error and they would die or be disabled in more than 6 months. I want to look at medication errors even in the drug prescription aspect. Making mistakes in drug concentration, wrong time of drug dosage, overdosage of medications. Those are the things that cause errors, and it keeps going on and on. Medical errors also including prescribing the wrong medication at any stage of the treatment process that is preventable. I want to look at the method used to solve this medication error. We have the National Alert Network, the computerized provider entry system, automated dispensary cabinet, barcoding, and all the methodologies. These are the things that can prevent it. I want to look at innovation and collaboration. Epocrates is one of the apps that is very important to use. It reviews medication on thousands of medication, generic and name brand, over-the-counter medication as well. It reviews drugs. The application also identify black box warning, contradiction, adverse effects, drug reaction for healthcare provider to use. Also provide this mobile app is used to identify drug manufacturer, FDA status, and retail price as well. It addresses the problem, the uses. Epocrates. It addresses the problems in the workplace. It helps to reduce and potentially eliminate medical errors for the adult and pediatrician or pediatrics patients. Also, Epocrates can be used to provide information about drug interaction. With the use of the calculator application, within the system, it will allow users to use it and do calculation without making mistakes. And when I collaborated, I talked to people, ER nurse, this nurse practitioner, and a case manager. And these are the questions that I posed to them. Does information technology play any significant role in your evidence-based practice? What is your opinion in the impact of mobile technology? What is the most popular mobile technology in your medical field? What features of mobile technology positively impacts evidence-based practice? And can you tell me any social, financial, or ethical costs associated with this? Can you recommend, the best one to use to prevent medical errors? Overall, of all the interviewed respond when they're asked, they told me that Epocrates mobile application was very helpful in reducing medical errors. Mobile application can be very helpful in reducing errors because they provide, improve patient outcome, the quality caregiving. The use of this can reduce medication-related problems that arises. This will also, continue. There is also going to continue a need of this because of there is need for this Epocrates. Also, advancement of technology. Medical apps are being introduced as a now new to go for all the medical professionals. Study has shown that 80% of these doctors use smartphones, and mostly of them use tablet at work. There is new wave of technology. There is this recent development of technology that are evolving in using the medical health app. And Epocrates, an app that provides drug-oriented help and news about all the over-the-counter and generic medication, comes completely different from quite a delectable and other features. I want to look at the features. Look at the feature that it has. Review information, safety monitoring, identification, provides information about pharmacology. This is look at all the features. Drug information, pill identification, clinical practice, interaction check, ICD code 10, disease information. And look at it's so beautiful. Notification formulary, alternative medicine, text messages, favorite calculator. These are all needed, that are very useful, that has been provided by, Epocrates. Above all, Epocrates offers all-round drug-related information medication information to drug use to the user, and using it will help immensely to reduce medication error. Thank you so much. Thank you so much for looking at my innovation projects, and look at the references that I have laid out. There are quite of them. Thank you. Thank you.